Hi, I'm Rhonda Vinson, and my community assessment presentation is on the city of South Pasadena, Florida. In 1942, the city of South Pasadena was included in what was then known as Pass-A-Grille Way. At the time, it consisted of 8 buildings, a main street, Corey Avenue, and 23 residents. On July the 1st, 1955, the small city of South Pasadena was incorporated. With a population of 150 residents, the city named Maynard Duryea as its first mayor. South Pasadena occupies an area on the west coast of Florida, and it shares boundaries with St. Petersburg, Gulfport, Treasure Island, St. Pete Beach, as well as some unincorporated areas of Pinellas County. Community structures. Today, the city of South Pasadena has 5,000 residents, a fire department, city hall, hospital, and its own commission form of government. Other community structures in South Pasadena include shopping centers, grocery stores, restaurants, banks, and pharmacies. It also contains assisted living facilities, nursing homes, long-term care facilities, and rehabilitation centers for their elderly, as well as waterfront apartments, condominiums, single and multifamily homes, mobile home communities, and 4 beautiful parks that residents can enjoy year-round. As a small city, South Pasadena is structurally sound and meets the needs of most in the community, but there are structural issues associated with this city. While doing my windshield observation, I noticed that there was no public swimming pool in the community and only one playground for young children. There was no local library for its residents, and although it did have 2 elementary schools in the community, there were no middle schools or high schools. And there was also illegal dumping. Homeless people had created a tent city under the bridge using tarps and lawn furniture, and they were dumping trash, beer bottles, and paraphernalia on the ground and in the water. Business closures and vacant lots are structural issues observed in the community as well. Analysis of the population. According to the most recent U.S. Census, South Pasadena's estimated population is 5,017, and the overall median age of a resident in South Pasadena is 68.7 years. For every 100 females, there are 80.4 males. The racial composition of South Pasadena is 96.52% white, 1.62% Black or African American, 1.44% Asian, and 0.2% other race. The estimated median household income in South Pasadena is $35,784 compared to that of the state of Florida, $50,860. 11.7% of South Pasadena's residents live below poverty level, and the overweight people in South Pasadena make up 35.8% of the population compared to that of the state's 34.8%. The first and the second health concern in South Pasadena are heart disease and cancer, and together they make up more than half the deaths in Pinellas County. The third is unintentional injuries or falls. Many chronic diseases, heart disease, stroke, and heart attacks are preventable through behavior modification. Cancer can be considered an age-related disease because the incidence of most cancers increase with age, but old age does not necessarily lead to cancer. Falls are the most common cause of traumatic brain injury among older adults, and up to 30% of the people who fall suffer moderate to severe injuries. And this is an analysis of the population. It's a 2018 comparison study done by the Department of Health for the state of Florida. The data suggests that Pinellas County has a larger number of heart disease and cancer-related deaths compared to Hillsborough, Pasco, and Polk counties. Health-related resources and availability. Health-related resources in the community are accessible, acceptable, and affordable for most in this community. These resources include Palms of Pasadena, which is a full-service hospital with an emergency room; Consult a Nurse, which is a free service designed to provide you with physician referral and health information. It's provided through Palms of Pasadena Hospital as well. Bayfront Convenient Care Clinic. This is an urgent care clinic that offers walk-in service as well as urgent care services. Palms Primary Care Offices. This is 2 internal medicine physician offices, and they focus basically on medical needs of those 18 years or older, including seniors in South Pasadena and St. Petersburg. The Health and Rehabilitation Center at Dolphin View. This is a skilled nursing rehabilitation center that also offers medical care. Egret Cove Center, the Springs at Boca Ciega Bay, and Gulfport Rehabilitation Center. All of these facilities are accessible, they are acceptable, but they may not be affordable for all in the community. Healthy People 2020 objectives. I chose heart disease and stroke as number 1 because currently more than 1 in 3 adults live with one or more types of cardiovascular disease, and cardiovascular disease is the leading cause of death in the United States, and it's also the number 1 cause of death in the city of South Pasadena. My second is nutrition and weight status, and I chose this because only 11.5% of physician office visits by patients who are diagnosed with cardiovascular disease, diabetes, or hyperlipidemia actually include counseling or education related to the diet or nutrition. And third, I chose older adults because the city of South Pasadena has a population of 56.7% age 65 and older, and aging adults experience higher risk of chronic disease and chronic conditions that can lower quality of life. Analysis of the environment. Environmental issues in and around the city of South Pasadena. Number 1, pedestrian safety. The city of South Pasadena has an intersection safety program. So red light safety cameras are to be installed at intersections within the city to encourage safer driving habits and promote pedestrian safety. Number 2, vacant and abandoned buildings. They are an eyesore to the community and they have a negative impact on the environment and the community. Number 3, drainage and sewage backups due to illegal dumping of debris. Number 4, another environmental issue that affects the city of South Pasadena is particulate matter. The size of the particles are directly linked to their potential for causing health problems. Particles that are 10 micromillimeter in diameter or smaller can generally pass through the throat, the nose, and enter the lungs. And once inhaled, exposure can affect the lungs, the heart, and cause serious health issues, including premature death in individuals with heart and lung disease, non-fatal heart attacks, asthma, decreased lung function, and this normally happens to people with heart and lung disease, children, and the elderly. Analysis of government and public policy. The city of South Pasadena has a commission form of government. 5 commission members are elected from the city at large, one of whom is elected as mayor. The 5 commissioners are responsible for adopting ordinances and resolution, implementing programs and services to meet identified needs, and for adopting an annual budget. All city council meetings are held at City Hall on the first Tuesday of the month, and the public is welcome to attend. As of September the 16th, 2019, the City Commission had determined that the General Reserve Fund was adequate to cover any unanticipated emergencies needed for the city for the next 6 to 9 months. The City of South Pasadena's annual budget does provide for all aspects of the community, and there was no economic concerns associated with the City of South Pasadena. South Pasadena has an unemployment rate of 3.2, whereas the United States average is 3.9. South Pasadena has a job market increase with 2.3 over the last year. The average income in South Pasadena is $35,780 per year, and no political or public policy concerns were associated with the City of South. Community needs, problems, and community diagnosis. A community need, heart disease and cancer awareness. And this is because the number one and number two health concerns in South Pasadena are heart disease and cancer. And again, together they make up more than half the deaths in Pinellas County. Number two is a community problem as well. It's ineffective health maintenance. Primary care physicians in South Pasadena see, on average, 1,376 patients per year, and that's a decrease from the previous year. Community diagnosis. Need for free or affordable medical care. South Pasadena does not have enough facilities that provide free or low-cost medical care for its community. The closest facility is St. Petersburg Health Department, and there's no guarantee that an individual will qualify for free or low-cost services there either. Other community needs. Risk for injury, because South Pasadena has a 56.7% population over the age of 65. Risk for decreased cardiac output. Heart disease is the leading cause of death for residents in South Pasadena. And risk for infection. South Pasadena has a 56.7% population over the age of 65. Thank you very much.